The Metered Dose Inhaler-Pipette is medical grade, made of surgical steel, 304 stainless steel. The Metered Dose Inhaler-Pipette is cleaned with 304 stainless steel teaser needles. The mill dispenser is also medical grade, made of 6061-T6 clear anodized aluminum, making it biocompatible. Included is a 1/8 teaspoon, also 304 stainless steel. The Metered Dose Inhaler-Pipette, mill dispenser, and teaspoon are all medical grade, and as with all surgical instruments, they are also sterilized in an autoclave. The Metered Dose Inhaler-Pipette is akin to a laboratory pipette, which dispenses measured units of liquid because the Metered Dose Inhaler-Pipette administers a measured 1/8 teaspoon unit of prescribed botanical cannabis by volume. To formulate a dose, first place a 1/8 teaspoon of pre-ground cannabis as prescribed between the top and bottom mill plates. The mill dispenser's ergonomic contoured protrusions were engineered after disabled steering wheel knobs for quadriplegics and arthritic hands. It's engineered for weak hands with limited dexterity, keeping our most vulnerable patients in mind because many lack the necessary strength required for standard grinders. The top and bottom mill plates are RC3, which is precision running, allowances and tolerances that provides ease of use for vulnerable patients. The Metered Dose Inhaler-Pipette, when inserted into the mill dispenser, formulates a 1/8 teaspoon microdose. The standardized dose now allows clinicians to more accurately monitor patients' use and effects. The mill dispenser's dispenser chamber has a precision running chamber, the closest fit that can be expected to run freely, intended for precision work at low speeds and light journal pressures, such as when the pipette is inserted into the dispenser chamber. The Metered Dose Inhaler-Pipette is thrice filtered with one stainless steel 304 mesh screen and two slim-fit 6mm dual-layered frustoconical plant-based cellulose and unbleached cotton filters spirals into the golden ratio. The threaded bowl is fitted with a 1/4-inch 304 stainless steel mesh screen that helps formulate the 1/8 teaspoon microdose once the pipette is inserted into the dispenser chamber. The taut keef extract mesh screen within the dispenser chamber helps to formulate the dose while extracting excess keef into the chamber below. The threaded bowl creates a helix that threads the cannabis upwards into the pipette's bowl up from the dispenser chamber while turning the pipette clockwise to formulate the standardized 1/8 teaspoon microdose of botanical cannabis. The pipette's bowl creates a vortex during inhalation that spirals for controlled optimal dose. Inhaled dry herb vapors travel through the bowl, then continues the vortex through the narrow bore immediately following the bowl, and then spirals into the aeration filtration chamber fitted with two 6mm dual-layered frustoconical plant-based cellulose and unbleached cotton filters, and lastly flows through the extended narrow bore of the mouthpiece, inspired by the saxophone mouthpiece, to deliver a smooth, consistent microdose. Our Metered Dose Inhaler-Pipette differs from the Schleider smoking device because our Metered Dose Inhaler-Pipette is engineered medical grade and sanitized with 70% isopropyl alcohol and sterilized in an autoclave. We differ in functions because our pipette is thrice filtered. The threaded bowl formulates a dose with fitted mesh screen and vaporized with included authorized flameless igniter. Schleider's bowl cannot create a repeatable dose, nor is it threaded to formulate a dose or filtered. Our narrow bore following helps to safely control the optimal dose. Schleider's wide bore offers no controlled dosing, allowing too much inhaled that risks overdose and substance abuse disorder. Our controlled dosing system and method mitigates cannabis use disorder with controlled microdoses. Schneider's optional second filter isn't enough to mitigate harms from inhaling large quantities at once. Their mouthpiece bore is not extended, creating greater risk of injury from the heat exchange when inhaling into their large, wide bore because the heat transfer funnels heat into the filter and its shallow bore will not create a safe barrier to the patient's mouth or lungs during inhalation. We differ from Robles smoking pen because we're medical grade, sanitized with isopropyl alcohol, and sterilized in an autoclave. Roble has a large bowl threaded to connect and ignite with an automobile's lighter. However, the federal government prohibits cannabis smoking in an automobile and prohibits it in parked cars as well. The Roble threaded bowl is not designed to formulate a repeatable dose. Vaping oils has also been deemed unsafe by the health department. Our device provides controlled flameless ignition of microdoses of botanical cannabis because dry herb vaporization is the only safe method of inhalation according to the health department. Microdosing is the recommended titration for medicine, including botanical cannabis. Our mill dispenser differs from the DCOU grinder because our mill dispenser is medical grade made of anodized aluminum, which is biocompatible, unlike theirs made of zinc alloy, which is not medical grade. Our top and bottom mill plates are engineered RC3 for precision running for ease of use for weak, vulnerable patients and stronger patients alike, including the ergonomically contoured protrusions designed for quadriplegics and arthritic hands. The DCOU grinder depressions are not suitable for disabled hand use in comparison. Our mill dispenser differs from the DCOU grinder because theirs only has a ground flower canister. Our mill dispenser provides a dispenser chamber in place of a ground flower canister to formulate and dispense repeatable, optimal doses by precision for doctors to monitor patients' botanical cannabis dosing schedules with greater accuracy, which is ancillary to clinical and medical research use. Our mill dispenser differs from fake spot grinder because ours is medical grade for precision and ease of use by patients such as quadriplegics and those with arthritic hands. The fake spot grinder teaches it has multiple protrusions intended for strong, gripped users. The dispenser is intended for patients with little strength and no grip. Fake spot also has a ground flower canister but does not provide a dispenser chamber to dispense repeatable precision doses. Flow trap filter differs from the Jesperson filter because theirs spirals and is folded into a frustoconical shape, then rolled into a W in the center. Our flow trap filter is a 6mm dual-layered frustoconical plant-based cellulose and unbleached cotton filters, spiraled, maintaining the golden ratio. Jesperson filters are also made of cellulose acetate tow, which has been found hazardous to human health. Our Metered Dose Inhaler-Pipette differs from Tucker's electronic cigarette because Tucker's is a liquid oil vape pen, which is considered unsafe and recalled for medical use. Vaporizing is hazardous to human health and not the same as dry herb vaporization, which is found to be a safe method of inhalation. Our pipette mitigates risk by keeping our heating unit, the flameless ignition, separate from our device. Tucker's oil vaporizer's heating process alters the chemical composition of the essential oils, creating harmful volatile organic compounds, according to the American Lung Association. Our thrice filtered device system and method mitigates waste that voids harmful or potentially harmful constituents.
BRAZIER by OSJ Rx, Metered Dose Inhaler-Pipette for microdosing cannabis in dried flower.